Hello again, everyone, and welcome to another episode of Smart Lawyers Love Dumb Nurses. My name is Brian Smith, and today we are going to talk about why nurses eat their young. Now, I've heard that phrase ever since I graduated from nursing school in 1986. Nurses eat their young. It's also known as nurses behaving badly. The meaning is that existing nurses treat new graduates and inexperienced nurses poorly. They demean them, they're impatient with them, they talk rudely to them, they criticize them, and generally, they are very tough on them. Looking back, had I known the poor treatment I would receive from nurses and doctors early in my career, I am convinced I would have chosen a different profession. Pondering the question of why nurses eat their young, I cannot give a definitive answer. I do know the question has plagued nursing for decades, and the bottom line is it needs to stop. It reminds me of a police officer interviewing a victim on the street. And he said to the victim, "Can you describe the person who stabbed you?" And the victim said, "Well, he wasn't very friendly." But new nurses often are told ahead of their first job to be wary of mean-spirited nurses. Watch your back is a common warning. All of us have watched television shows or movie scenes depicting the charge nurse scowling at new graduates, barking orders, terrifying patients and nurses alike. Hollywood's version is a fantasy, of course, but nurse stereotypes are based on reality and reports of mean nurses. While Hollywood has toned down this depiction of nurses, the problem of nurses eating their young is still truly relevant today. Personally, my students and I have encountered negative along with positive experiences in clinical situations. Both experiences confirm that clinical settings are valuable learning opportunities for students. I look back on experiences where nurses were unwilling to have a student shadow them for the day, or they spoke to them in a demeaning way. Clinical environments must have a positive learning atmosphere so that nursing students can transfer classroom knowledge to clinical practice. I have many instances I could talk about, but one sticks out to me to validate my concern today. I was in a post-conference with students after a clinical in a large hospital several years ago. We were offered one of the few rooms available for a post-conference. During our debriefing, a group of nurse leaders, and I use that word lightly, suddenly came in and interrupted our discussion. My students and I waited for them to finish their meeting, but at one point, two of my students softly discussed a patient concern with me. One experienced nurse leader said, "You and your students need to be quiet. We are discussing something important here." My students were appalled at this behavior, and I was again disappointed that nursing students were given a poor example of nursing leadership. In a profession best known for its value of caring, it seems to me that nurses sometimes lose their empathy, especially as they move up the ranks. Drama in clinical situations must always be avoided. This is nursing school, not a Shakespearean play. In particular, with the nursing shortage around the country and around the world getting worse, not better, it is important that we treat our nursing students and our young nurses with respect. this is not our grandmother's nursing profession anymore. But what can be done to properly welcome our graduating nurses into this beautiful profession? And what are viable options to keep new graduates on the job? Studies have shown that 60% of new graduates quit their first job due to rude behavior from coworkers. First, nurse leaders must be aware that new nurses have anxiety, to say the least, and even terror at the thought of starting their first job. Those who are assigned to orient new nurses often are randomly chosen for the role. There is often the distinct possibility the new nurse is shadowing a nurse who does not want that responsibility of teaching them. Nurse managers or charge nurses must be cognizant of which nurses are best suited to orient new nurses. The best nurses know how to teach. They prefer constructive feedback to negativity. They have enough common sense and tact not to openly criticize in front of patients or coworkers. Veteran nurses should remember that everyone has a first day. What is sometimes forgotten by veteran nurses is that they were once inexperienced students and new graduates. All experts were once beginners. I found myself constantly searching for nurses who were willing and able to give their expertise. It was very disappointing that I had to gravitate away from the demeaning behaviors to support my students. Nursing students appreciated that positive communication of professional nurses who created an atmosphere conducive to teaching and learning. The best communicators welcomed me and my students to the clinical site. This style of encouraging conduct increases nursing students' independence. The one area you would not expect bullying is in the nursing profession. Bullying comes from having a love of power more than a love of people. Again, it is nurses behaving badly. Maybe it occurs so frequently because the older nurse believes they have earned the right to be rude or condescending. Often student nurses and new graduates consider it a badge of honor to endure a browbeating from an experienced nurse. But let's be clear, if you are not a good person, you will not be a good nurse. No matter how well you did in nursing school, no matter how book smart you are, no matter how good you look in that nursing uniform, there is no room in nursing for bullying. Others may describe it as horizontal violence. I have come to refer to it as a culture of criticism. Whatever the description, there is no purpose or need for it in nursing, or anywhere else for that matter. I have also experienced it up close and personal in more than a few instances. I cannot accurately explain why some nurses treat coworkers with impatience or discourtesy. Some managers and people in power believe that you must show strength by taking the hard line. There is something called the principle of double effect. This doctrine explains that it is permissible for an action to cause harm as an unintended side effect or double effect if it brings about a good result in the end. According to the principle of double effect, it is permissible in some people's mind to inflict maltreatment if the result is positive. We see this most often in coaching or with a drill sergeant in the military. This doctrine has been utilized for centuries. In some cases, the principle of double effect is effective. However, it does not hold up well in nurse training to discard something valuable along with the undesirable things. In taking a hardline approach to teaching discipline and policies, nurses throw the baby out with the bathwater. There are many other contributing factors to bullying, incivility, and rudeness. Let's face it, caring for sick people is stressful, especially if compounded by a patient who is demanding. Add to that equation factors such as poorly trained staff, managers' unreasonable expectations, or families that are demanding a nurse's time. Nurses who work in stressful situations often do not know how to manage stress as well as they should. This was a hard lesson that took me years to fully understand. It is now a skill that I highly appreciate. Some hospitals and nursing facilities have come to realize the importance of proper behavior among staff and holding employees to a higher standard. Information is often discussed with new employees when they start orientation regarding employee values. Standards such as greeting everyone with a smile, making eye contact, and asking if the customer needs help are some examples. What has gotten lost in all this customer service improvements is that coworkers are also customers. Every customer must be treated with the utmost respect. I have never been fond of the term nurse manager. Nurses need leaders, not managers. Nursing needs to let managers stay on the baseball field. I believe the ineffective nurse managers have contributed not only to the bullying problem, but also to the nursing shortage. The worst nurse managers I have had, and I've had my fair share of them, were more concerned with their bottom line than they were leading the team. Do as I say, not as I do. They may have managed the books and budget nicely, but they could not lead or inspire greatness. In truth, a manager is best suited for controlling events, objects, strategy, and details, not for leading people. The best leaders know how to communicate properly and know how to listen first, not just hear. Hearing and listening are two different things. Talking and communicating are two different things. True leaders lead by example. The best nurse leaders I work with were not just experts in nursing skills. They listened intently and spoke patiently. True leaders are aware of what is going on with the new hires and address situations before they get out of hand. True leaders also did not allow power to go to their heads. Often those in a position of authority produce bullying behavior because they have an inflated sense of importance. In my almost 40 years in nursing, I have seen it all. Nurses do not consciously become bad nurses. There are many factors. You could say nurses develop into bad nurses because they do not develop. Coping and communication are as important as any nursing skills. Poor coping and poor communication lead to conflicts that cause team members to look elsewhere for employment. Maybe nursing has become too challenging or not challenging enough. There is nothing worse than working just to get a paycheck. That philosophy may be a standard with some professions, but it does not fly in nursing. Unprofessional behavior within healthcare organizations in the form of incivility and bullying adds more stress to an already stressful environment. It also jeopardizes patient safety. It is simply too important to be swept under the rug in any organization. Nurses are not the only profession on the receiving end of incivility. The service industry, such as fast food employees, airline workers, promoting a civil work environment requires a committed effort by organizational leadership and individual team members. When faced with unprofessional behavior, most people choose to fight or flee. Some respond immediately as a form of defense. Others choose to ignore incivility to minimize the situation, inadvertently sending a message that the behavior is acceptable. Some people recognize the inappropriateness of the behavior, but they lack the knowledge and skills to respond accordingly. The best leaders foster a work environment of communication and collaboration. True leaders understand the consequences of incivility and bullying and relay the dangers of it to the team. A stressful or unstable home and family life can escalate tensions at work. It is especially important to not let your personal life interfere with your work. If you are having conflicts on your job, talk to your direct supervisor about it. It is best to openly discuss bullying issues with your direct supervisor before the situation intensifies. Nurses in some organizations may feel nervous about reporting bullying. To address bullying, it is best to take a systems approach. Open communication should start with human resources for guidance. A proactive approach and advocating for yourself contribute to a more supportive workplace environment. One of the saddest things I have noticed about young nurses is when they change from sweet, soft-spoken new graduates to less sympathetic, more tough-thinking veterans. I am encouraging you to not morph into some of your hardened colleagues. Stay true to who you are and what drew you to nursing in the first place. When people treat you with disrespect, believe them. But I have a warning for you. When you treat people like they treat you, they get upset. Every test, every tribulation, every trial, every tormentor, every torment, every torturous journey is an opportunity for you to show your true heart. The real you will be revealed in those moments. It is not a mean nurse who worries me. It is a mean-spirited nurse disguised as a nice person whom you should be wary of. Some years ago, I became a faculty member at a school of nursing that I loved. It was the nursing school where I attained my very first degree. I was assigned a mentor to guide me through the first year of my new job. I had first met her when she was a nursing instructor and taught clinical on the hospital floor where I worked for 15 years. I remember her students often asked to be assigned to me as their preceptor for the day. I remembered her nervously trying to perform nursing skills with her students. Often she was unable to successfully guide students on Foley catheter insertion or in inserting an IV, and my colleagues and I assisted her students. Those experiences helping to teach her nursing students years earlier inspired me to become an educator. And now she was my mentor on my new job as a nurse educator. However, it quickly became apparent that my mentor was becoming my tormentor. During my first months on the job, when we sat down and reviewed my performance, she was progressively more critical. I remember her saying during one meeting that I was unorganized and she always had to chase me down. I explained that I was performing my assigned duties and that I would gladly meet with her if she would schedule a meeting. On another occasion, she stated that she could not figure out why my students loved me so much. She mused that she wanted to give me a mental exam, why I had a psychological desire to help students. I stared at her in confused disbelief, but I kept my thoughts to myself. The nurse bullying issue I had read about in journals, I was now experiencing in full color. Later, students approached me and stated my mentor asked them if the reason they enjoyed my teaching was that I gave them exam answers and coddled them. She theorized that because I was not a competent teacher, I survived by giving in to the students. Keep in mind, this was an instructor I had observed at my prior job who developed few clinical skills over 30 plus years. Her speaking tone in lectures was taciturn as she presented antiquated PowerPoints in a monotone and dry manner. Her students often complained to the school director of nursing about her, not knowing they were good friends. My mentor was considered a leader at the school, but her bullying tactics against me and my students resulted in me leaving the school I loved after 1 year. Valleys teach us lessons about how to get to the mountaintop. Strong people rarely have an easy life. Every day you must ask yourself, does this person or situation help me get to the life I am creating? It takes perseverance, or what I call grit, to get the life you want and deserve. G-R-I-T, grit. It's 1% talent, 1% luck, and 98% never giving up. It has been said that the eyes are the window to your soul, but how you react to an event in a vulnerable position is a window to your heart. Do not worry about the storms in your life. often storms come into your life not to challenge you, but to clear a path for you. We all have chapters in the book of our lives we do not want to be published, but it is those chapters that make the book worth reading. I suffered through that experience with my mentor turned tormentor. I decided to share it with you today. It has helped verify my views on the damaging effects of nurse bullying. My advice for those of you who experience bullying is not to waste time hating people who hate you. Instead, gravitate toward positive people. Love people that love you. I came to realize that in life, we either win or we learn. I know my worth because I paid dearly for it. The life behind you is just as important as the life ahead of you. I learned valuable lessons during that storm that came into my life. I discovered that I want to be so positive that negative people will avoid me. Mental strength comes from lifting yourself every time you are knocked down. Sometimes success is not how much you achieve, it's how high you can bounce when you have been knocked down. The trial by fire that I endured with a mentor was one of the motivating factors in helping inspire me to go back for my doctoral degree. I do not think I would have achieved a doctorate had that storm not come into my life. And later, I found my dream job at one of the greatest nursing schools in the country, which I will work at until I ride off into the sunset. I think that's a good place to end our podcast for today. My name is Dr. Brian Smith. Stay focused, stay inspired, and stay tuned. Thank you for listening.